Today we are looking at the TNM staging of the carcinoma breast. So we start with some questions. The first question is, what does a T3 staging indicate? And the second one is, what does the N3B stage indicate? So in this video we'll find these answers and learn in detail about this topic. So to start with, we need to know some keywords, that is, in terms of tumor. T is for the tumor, so TX. So what does this TX mean? TX means the primary tumor. Primary tumor is can't be assessed, can't be assessed. So this is what TX means. Then when we look at T0, it indicates that there is no evidence of primary tumor. There is no evidence of the primary tumor. Next, when we look at the TIS or the DCIS, so this is nothing but the ductal carcinoma in situ. Then when we look at the TIS Paget, so this is the TIS, it is Paget, PAGET. So this is nothing but the Paget's disease is the Paget's disease. So this disease is not associated. It is not associated. So it is not associated with invasive carcinoma, or DCIS. Now we'll just recap what we did. So here we saw what is the staging. So TX, it stands for the primary tumor and it cannot be assessed. Next we have is the T0. So T0, there is no evidence of the primary tumor. Next, when we look at the TIS, that is a DCIS, here this is nothing but the ductal carcinoma in situ. Then when we look at the TIS Paget's, so this is nothing but the Paget's disease and it is not associated with the invasive carcinoma or the DCIS. So to move further, now we'll enter the staging grading. So first we look at the T1. So what does this T1 indicate? So T1 is nothing but less than 2 cm in greatest dimension. This is less than equal to 2 cm. Next, when we look at 1 MIC, so this is less than equal to 0.1 cm. Then when we look at the 1A, so 1A is nothing but greater than equal to greater than the 0.1 to 0.5 centimeter. This is 1A. Then what about 1B? 1B is greater than 0.5 centimeters to 1 centimeter. Then what about 1C? So 1C is nothing but greater than 1 to 2 centimeters. Next, when we look at T2, what is this T2? So T2 is nothing but it is greater than 2 but less than equal to 5 centimeter in the greatest dimension. So to recap, we saw the T1 classification. So T1 is nothing but it is less than equal to 2 centimeter in the greatest dimension. So we have 1 MIC, so this is less than 0.1 centimeters. 1AB is 0.1 to 0.5, 1B is 0.5 to 1, and 1C is from greater than 1 to 2 centimeters. Next, when we look at 2, the 2 and 2, so 2 is greater than 2 but less than 5 centimeters in the greatest dimension. Next, after 2, we'll move on to T3. So what is this T3? So T3 is nothing but it is greater than 5. It is greater than 5 centimeters and this is in the greatest. It is in the greatest dimension. Then we move on to the T4. So what is T4? So T4 is nothing but the tumor in any size. Tumor is any size. And to start with, we look at 4A. What is 4A? 4A is nothing but the chest wall involvement. It is a chest wall. Chest wall involvement. And except, so there is an except the pectoralis major. Pectoralis major. Next we have the 4B. So what is 4B? Is basically the skin involvement in form of ulceration. So it is nothing but the skin involvement in the form of ulceration. In the form of ulceration. Next they also have the pudi orange and satellite nodules. Then when we look at 4C, 4C is nothing but a combination of 4A plus 4B. Now let's recap. So we saw T3, it is greater than 5 centimeters in case of the greatest dimension, and 2 was from 2 to 5. And now when we look at T4, T4 is basically any size, and there is 4A. What does 4A involve? 4A is nothing but there's an involvement of the chest wall and except the pectoralis major. Then when 4B, there is a skin involvement. Skin is involved, and there is in the form of there is ulceration. There can be pudi orange appearance. There can be the satellite nodules which can be seen. Then what is 4C? 4C is nothing but a combination of 4A and 4B. Next we'll move on to the 4D. So what is 4D? So 4D is nothing but it is an inflammatory breast carcinoma. It is an inflammatory breast carcinoma, and this is typical skin changes involving, it is a typical skin change. Okay, it is a typical skin change, and it involves greater than 1/3 of the breast. Next we look at the nodes. So what are the nodes? So nodes we have it is written as N. So first when we see as N1 MIC, so N1 MIC refers to the micrometastasis to the lymph node. Nothing but the micrometastasis to the lymph node. Then we have the N1. So what is this N1? N1 means there is a ipsilateral. There is a ipsilateral mobile. There is ipsilateral mobile axillary lymph node. Then we have the N2A. N2A is nothing but the ipsilateral fixed. It is ipsilateral fixed or it is mated. Ipsilateral fixed or mated axillary lymph node. Then, so just recap. 4D, what we saw, it refers to the inflammatory breast carcinoma, and it has a typical skin change and involves about 1/3, greater than 1/3 of the breast. Then we look at the characteristic of N. N is for the nodes. So in N1 MIC, it is nothing but the micrometastasis, and it involves the CN. Then we have N1. N1 is nothing but the ipsilateral mobile axillary lymph node. And then we have the N2A. N2A is nothing but the ipsilateral. It is fixed or mated, and it is an axillary lymph node. So this was about N2A. Next we look at the N2B. So what is this N2B? So N2B is nothing but an ipsilateral. It is an ipsilateral internal mammary. So ipsilateral internal mammary, and it is without the axillary lymph node involvement. Next we have the N3A. So what is this N3A? So N3A, it is nothing but the ipsilateral infraclavicular lymph node. Then when we look at N3B, it is nothing but the ipsilateral internal mammary, ipsilateral internal mammary, and the axillary lymph node. Lastly, when we look at the N3C, it is the ipsilateral supraclavicular lymph nodes. So then we have another concept of the distant metastasis. So distant metastasis. So what does this include? So this is nothing but M0. M0 stands for the absence of the metastasis, and M1 basically stands for the presence of the metastasis. Now just to recap, the N2B means it deals with ipsilateral and there is an internal mammary, and it is without the axillary lymph node involvement. Now when we look at N3A, it is an ipsilateral, it is an infraclavicular lymph node, and 3B, it is ipsilateral, it is internal mammary and also the axillary lymph node. So it has both. And then we look at the NC3, 3C, here it is ipsilateral supraclavicular. So 3A is infraclavicular, 3C is supraclavicular. Then when you look at the distance metastasis, M0 stands for that there is no metastasis, whereas N1, it stands for that there is presence of the metastasis. Now we'll be answering our questions. So we asked, the first question was in terms of the T, what is T3? This was our question. So T3 is basically where the tumor, it is a greater than 5 centimeter in the greatest dimension. Next question we asked was, what does N3B indicate? So N3B indicates that there is a ipsilateral internal. There's a ipsilateral internal, that is the mammary and the axillary lymph node. So now just to recap what we did, this is the T3 which we asked the first question. So T3 is greater than 5 centimeters in the greatest dimension. Whereas now if you see 3B and 3B, it is the ipsilateral, it involves the internal mammary as well as the axillary lymph node. So this was about the TNM staging. To learn and grow more daily, please do subscribe.